fungi on US 70 is Candida albicans. You want to learn this in the sketch video. The first one, the Canada flag. I'm wearing the Canada hat. That's gonna be Canada albicans. Opportunistic infection. We can see over here there's gonna be a butterfly over here. Who's gonna be dimorphic. So cold mold heat. Cold mold in yeast in the heat. So we can see there's gonna be dimorphic fungi. This is going to be what differs from other dimorphic fungi in that they form pseudohyphae budding yeast and in germ tubes at 37 degrees, which would normally be like a yeast in our other fungi, which we spoke about: Histoplasma capsidum, Basomycosis, Dermidis, Cochidoides, emitens, and Paracocomycosis. Okay. Yeah, so that's going to be. Let me just check out the name of that drug. So that the Paracocodomycosis. Okay. Anyways, so then we can see that basically these are the opposite. I want to speak a little bit to you guys about this. I'm gonna be speaking that about these pseudohyphae. Okay. So basically, pseudohyphae are basically thread-like filamentous structures which make up the body multicellular fungi. Pseudohyphae, because they mimic the true hyphae, they are not truly filamentous hyphae. Rather, they are like chains of budding yeast. So they're not really filamentous. There's going to be like a lot of budding. So we call these pseudohyphae, which basically means fake hyphae. Then we can see at 37 degrees over here. We can see that Candida albicans forms germ tubes at 37 degrees. So as you expect, cold mold, heat yeast. Over here it's opposite. So in the cold it's a yeast, and it's a mold in the heat, which is showing over here. Germ tubes at 37 degrees, mold form essentially. The next thing over here is going to be, we can see that when we come 37, we come down over here into the 20 degree snowballs over here. We can see that this is Candida albicans form pseudohyphae budding yeast at 20 degrees, which is yeast form. So Candida is grown on human or sheep serum, 37 degrees for 3 hours, and they form germ tubes, which can be detected on potassium hydroxide films, and the filamentous outgrowing extending from yeast cells. We can see there's going to be a cat, which means that it's going to be catalase positive. Then we can see this child over here means it can cause diaper rash. It can cause Candida intrigo. So that means between the thigh area, it can cause these, especially with this heat, humidity, can cause rash in infants. Okay, then we're gonna come over here to number 7, which is going to be so 7 is going to be our immunocompromised cane over here. So this is going to be an immunocompromised, especially in people neutropenic, can cause disseminated disease. Okay. The next thing over here is going to be the mouth. It can cause like basically oral mucocutaneous candidiasis. So basically oral thrush due to Candida albicans, who commonly presents with white patches on the lining of the mouth, are associated with oral inhaled steroid use and immunosuppression. So oral the thrush produces slightly raised, creamy white sore patches in your mouth or on your tongue. So this is going to be the sore patches on the mouth and the tongue. And then we can see over here number 9 over here is going to be this woman who she's with the shoveling in the snow. So white patches of Candida albicans that form the lining of the mouth can be scraped off. So these can easily be scraped off. We can see this potassium hydroxide salt. So this can be diagnosed with like potassium hydroxide amount of the oral, vaginal, or skin scrapings. And the microscopic examination will show budding yeast and pseudohyphae. Then we can see the tunnel has a snow inside it. That's referring to vaginal candidiasis. So we can HIV associated esophagitis and AIDS defining illness. And this is going to be with adherent gray white pseudo membranes. Then we can see max 200 pounds, that we can see that esophageal candidiasis, the AIDS defining illness, occurs in patients with CD4 count less than 200. And then we can see the woman has a snowball and a crouch in that area. So this is going to be cause infection of the vulva and vagina, vulvovaginal candidiasis, which can produce very vulvar pruritus and a thick white discharge. So that's a very important sign. We can get a lot of pruritus over here. Then we can see the person, she dropped her purse, and we can see these pills over here. This is going to be we can see uncontrolled diabetes, antibiotic use, high estrogen levels. Therefore, oral contraceptive, pregnancy are risk factors of vulvovaginal candidiasis. Then we can see the play until 4 p.m. So we can see the normal vaginal pH is going to be remains normal. So this is going to be 3.8 to 4.5 in vulvovaginal candidiasis. Then we can see these roofs over here. So that's going to be involving the tricuspid, tricuspid valve, social IV drug usage, and prostatic heart valve, and doing catheters. Then we can see over here the pike cones over here, so piconazole. And we can see that frogs over here is going to be amphotericin B. And then we can see over here play nice. So nice and topically to treat candida skin infections. Then we can see over here the cap. So really a cap, caps fufugen mycofungin, which is going to be used for the treatment of candidiasis. 20 key points, guys, we need to remember for Canada. One is the Canada flag over here, which is in help us remember Canada. Number two is going to be that it can, this is the tricky part actually, it's a dimorphic fungi, so that's going to be the butterfly, but it's going to be it differs. So it forms pseudohyphae and budding yeast in the cold. And then germ tubes, which is basically your mold form, it's going to be there in the heat. You can see 37 fever, it means against in the heat, it's going to make molds, which is going to be your germ tubes. And then we can see 20-degree balls, which is going to be pseudohyphae and budding yeast at 20 degrees. We can see the cat over there. We can see the diaper over there, which is going to be diaper rash. Then we can see that it's now he's shoving off the snow, which is going to be that this is going to be oral mucocutaneous candidiasis, potassium hydroxide. Then we can see AIDS defining illness can involve the esophagus. If it's going to be less than 200, it's going to be AIDS defining illness over here. We can see a snowball of the crouch. This is going to be vulvovaginal candidiasis. Then we can see over here, there's going to be the oral contraceptives, OCPs, this is going to be uncontrolled diabetes, antibiotics, high estrogen. Then we can see the normal pH is going to be 3.8 to 4.5, that's going to be over there. And then we can see these roofs, the roofs are going to be for tricuspid valve. Then we can see fluconazole, amphotericin, then we can see plain nice, and then we can see capsufugen or mycofungin is going to be for treatment of Candida albicans.